Capacity building in the HIV space is a process for equipping the nation's HIV prevention workforce, including staff at state and local health departments and community-based organizations, through training, technical assistance, and other resources to reduce HIV infection and improve health outcomes for people with HIV. You are watching The Last Mile with NACA. I am Adesu Ausui. The National Agency for the Control of AIDS, NACA, and partners invest a lot in capacity building and empowerment programs. These investments are made to enhance coordination and ensure sustainability of the HIV response.
The importance of capacity building and empowerment to the HIV response cannot be overemphasized. This encompasses quality, effectiveness, efficiency, client-centeredness, safety, accessibility, equity, and sustainability of all HIV clinical services and related non-clinical support. To address poverty and unemployment, which are both drivers of the HIV epidemic, the National Agency for the Control of AIDS, NACA, with partners, have carried out several empowerment programs for vulnerable populations, both HIV positive and negative, across the country.
HIV is a disease that has to do with poverty, a disease that is also to some extent fueled by insecurity. It has an economic angle to it, it has the health perspective to it. So it's a disease, if you want to fight, you don't just fight it from the hospital perspective alone. You have to go into community, you have to identify vulnerable individuals, people that are at risk, and find ways, to reduce that risk. So in finding ways to reduce the risk, we have had programs that concentrate on vulnerable population among people that have the virus, and also among people that don't have the virus, to support them and empower them and also educate them. It's much faster if we show some kind of human face to it, where we're not only concentrating on telling them what to do, we are also concentrating in helping to empower them to be able to do what we want them to do.
I don't know there is a platform like this, so I was so happy to be part of this empowerment, and it has been an interactive class, and it is actually an educative one.
I'm learning barbing, and at least after the program I'll be able to establish myself, and at least in the community it will be a very, very easy one, and it will be of help to every one of us in the community.
It will help us to sustain ourselves and our family. When one is empowered with work, with skills, that one will make it to go a long way, to become a better person in the society. And that's why I'm saying a very big kudos to those that are organizing this training. I'm so grateful and so happy. Thank you, and God bless you.
To ensure that the state response is well coordinated according to the National Strategic Plan, the agency also builds the capacity of the state agencies for the control of AIDS, SACA.
First of all, NACA's mandate, and by extension the zonal office's mandate, is to make sure that we capacitate the state agencies for the control of AIDS and make them visible and make them strong enough to be able to coordinate their state responses. And there's a level to which the state response can go. So we had to now, after capacitating the SACAs, got them to capacitate the LACAs. And in what area? It was in generating evidence. Because you need data to be able to do whatever you want to do. So we working with the SACAs now engineer the means, a way whereby non-health sector data and health sector data were, collated together comprehensively.
NACA also engages communities of people living with HIV to ensure ownership through training, mentoring, mobilization and support supervision to further enhance uptake of HIV treatment, care and support services.
NACA have been instrumental because NACA actually supported APIN, I remember 2016, to pilot what we call Lock the Virus. So Lock the Virus was a project whereby adolescent girls and young women were empowered with knowledge and were deployed to engage their peers at the society, at the community, sensitizing them about HIV and also getting them to go for testing. So, and psychosocial support will also follow up. And we have done series of condom outreach with support from NACA and also AHF. And we are also hoping to do more. I really appreciate the fact that at the moment we are currently working with NACA, and we just started what we call Adolescent Kids for Expression, which is supported by UNICEF as well, across 7 states, Rivers, Lagos, Cross River, Enugu, Kaduna, Benue, and FCT. So, and actually that intervention is a model that is designed to strengthen community structures of APIN and its PLHIV members, and empowering young people as community facilitators to continue to engage other adolescents through support group platform.
In a bid to drive its sensitization campaigns further into the grassroots, the agencies carried out several capacity building workshops for the media.
Media had always worked with NACA, and we've had so many guidelines, so many documents that we just decided to go through all, and a lot were still very relevant. And now, when I talk media, I'm not talking corporate, I'm talking behavior change communication. But we needed the media to be able to get the public to support NACA's policies and programs. And that made us now initiate the strategic media engagement. It was a very robust engagement because we met with all sectors that are involved, key actors that are involved in the HIV response in the zone. That helped us again to capacitate the media. For them to be advocates, they needed to be very conversant, very HIV competent. So we built their skills in HIV and the issues around HIV, and then we got them to be advocates.
HIV, by its nature, it's a human matter. And so when you are going to talk to the person, to the human person, you need to speak to the person's heart and to the person's brains, all right? So you need stories that are emotional in nature, and that's what's missing. A lot of Nigerians know about 1 or 2 things about HIV by now, but what's missing is that compelling feature story that will move that person from the point of awareness to the point of knowledge, where he or she is able to, on her own or his own, be able to take a useful decision to improve his or her well-being using factual reporting by the media.
For us journalists, we normally, think we know it all until you come to places like this and begin to understand that there are certain things you don't know. And for the work that we do, to be able to effectively inform people, we need to be informed. So for me, my key takeaway is this. Sincerely, before now, I didn't know that there was something like PrEP. But now that I know about PrEP, I'm going to be doing a lot of research about it. I'm going to be helping them disseminate that information. For me, it's my key takeaway.
This program has been very, very impactful because in the past, I've been seeing, HIV and AIDS from another different angle. The way we write stories, we just write them, we just feel I have a story to write about somebody. But today with this, I've come to understand that I have to write the stories with empathy. I have to put them into consideration that they are human beings. They could be somebody's sister, they could be somebody's brother. So it has really changed my perspective towards writing stories about HIV and AIDS.
HIV and human rights. These are very related issues that we need to raise awareness. We have to eliminate gender-based violence for us to actually eliminate AIDS and HIV transmission. control epidemic, because we see, especially within the time of lockdown, a lot of women were abused. Even we have young girls, even boys, having sexual abuse. And sexual abuse, like I already established, is there's strong relationship with the transmission of the virus. So they are very related, and that's why we're raising awareness that everyone must come out to work at ending violence, any form of violence, particularly gender-based violence.
NACA has also made donations of medical equipment to state governments in order to support their HIV response.
We're here to present a few number of ambulances that we believe will complement your effort. We know you have established hospitals across the states. You've established primary health care across the states. But we also believe that ambulances are very essential, especially in transporting emergency cases to those centers. And we're looking at going beyond that, but at the moment, this is what is available at our disposal, and this is solely with the support of the Global Fund System. It is important to strengthen the states and to strengthen the states surrounded in their neighborhood to make sure in the event of outbreaks of COVID-19 magnitude, we are well fortified to take care of those emergencies. We've worked with Jigawa State in the last couple of months to establish structures at the community level, engage individuals at community level in 5 local governments in Jigawa, including Roni, Taura, Suletankarkar, Goram, and in those local governments, we hired a total of about 600 individuals that receive direct payments from us through primary healthcare system. And this continues until our grant ends in 2023.
Today, the receipt of these 4 brand new ambulances, fully equipped, is very, very significant to us. Jigawa was very low internally generated revenue because of the lack of high tax base. Is very, very happy to receive this donation. You might think it's small, but it means a lot to us in the government and the people of Jigawa State, because what you have supported us today with will now help us divert the fund that is earmarked for these buses into other social services for the benefit of our people. We can't thank you enough. We believe you have Jigawa in your heart, and indeed the country through your antecedents in your heart while you are discharging your responsibilities.
The success and quality of HIV and AIDS prevention programs depends upon long-term investments to build the technical and organizational capacities of the public, private and NGO institutions which deliver services.
Sister! Where you dey rush dey go like this now? Take am easy now.
Na hospital I dey go to do HIV test.
Na everything you dey do HIV test. Before you carry belle, you do HIV test. Now you dey rush go do another HIV test. Wetin you dey find, you go see am o.
No be so, my sister. HIV test no be bad thing o. Na make I know my status so that no matter the result, my pikin no go get HIV.
HIV fit pass from mama to pikin?
Yes o. During pregnancy or labor or even when we dey breastfeed the pikin. Yes, and my husband dey road dey come sef, he go meet me for hospital. We go do the test together.
Hey, your husband na man he be. But wait o, una no dey fear. What if the result come out positive?
Fear wetin na? HIV no be death sen ten ce, and medicine don dey to take manage am. see, nowadays people wey get HIV, they live their life normal like everybody else.
You sure say I no go follow you go do my own so?
Wetin you dey wait for now? Come make we go jare. With quick action, we fit stop this HIV waka from mama to pikin. Go do your own HIV test today.
The update segment brings you highlights of NACA's activities across the country and elsewhere. Keep watching.
In commemoration of International Women's Day, the International Community of Women Living with HIV and AIDS, ICW, West Africa region, held an award ceremony to honor persons whose roles have been instrumental to the reduction of HIV in Nigeria. The regional coordinator, ICW West Africa, Assumpta Reginald, delivered the opening remarks.
The International Women's Day 2022 campaign theme is a call to activity to break the bias in cultures and systems that limit women's ability to reach their full potentials. This year, ICW West Africa and ASWAN stand in solidarity with all partners working to eliminate mother-to-child transmission of HIV and promote women's empowerment. I want to give kudos to DG NACA because he has done a lot by ensuring that numbers of women who are now accessing PMTC has drastically increased. Please let us give a clap to NACA. A toast to mentor mothers who has helped the country to achieve these successes. It's therefore my great pleasure to welcome you all, our distinguished partners, heroes, ambassadors, champions, friends, to this memorable event. Collectively, we can all break the bias. We can break the bias in our communities. We can break the bias in our facilities. We can break the bias to make it work. And we can also break the bias in Africa and the world.
In his remark, the Director General of the National Agency for the Control of AIDS, NACA, Dr. Gambo Aliyu, highlighted the role of women in the HIV response, especially with regards to mother-to-child transmission of HIV.
Women have dedicated themselves, access our services all over the country, test for HIV, access treatment services when offered, remain on treatment, cooperate with us all over the country to prevent mother-to-child transmission. I congratulate the Association of Women Living with HIV/AIDS for coming together to recognize the importance of celebrating Women's Day in a special way, and with special recognition to women living with HIV/AIDS, and also to recognize the importance of pushing for the elimination of mother-to-child transmission. And we look forward to working with your memberships at the community level all over the country, especially this year, when we peg a goal for ourselves to double our access to pregnant women all over the country in our quest to improve coverage, at least from the current 43-46% to about 92% before December.
Dr. Aliyu called for an end to stigma and discrimination in the HIV space. This is a major barrier for the agency in extending its coverage of HIV services.
People find it very difficult to come forward and demand for HIV services. Not that they don't like the services, not that they don't want to know about their status, but they are very fearful of the consequences of positive results. And that fear is what all of us should join hands to fight. For people to know that HIV services are now available. HIV no longer kills. HIV can be managed like every other chronic illness. We stand with ASHWAN. We stand with women organizations and societies all over the country and globally in solidarity against violence, gender-based violence, in solidarity against marginalization, be it social, demographic, economic, whatsoever, against women. In the HIV arena, we stand in solidarity against stigma and discrimination. We stand in solidarity against inequity. And we stand in solidarity against inequality in terms of access to services.
Goodwill messages were delivered by some notable personalities present.
We would like to commend the international community of women living with HIV in West Africa and also Ashwan for the role that Ashwan and the ICW is playing in the national response. And the particular emphasis on PMTCT is perfect and excellent. You would know that in the Global AIDS Strategy and the political declaration, the UN political declaration, which Nigeria has signed up to, the role of communities in the global and national responses is very important, very well recognized and enshrined in those documents. And we would like to assure you that UNAIDS at the global level, the regional level, and the country level will continue to support the communities. So thank you very much, and please be assured of our continuing support.
This is a very unique occasion in the fact that we are celebrating the International Women's Day with the theme Breaking the Barriers. And we all know there are a lot of barriers that needs to be broken as far as HIV is concerned. The DG earlier had alluded to some of these barriers. Some barriers around identifying, pregnant women. I guess one of the challenges with our PMCT program over the years is that it's been tied to our ANC service provision. And we're beginning to see that that isn't so much of a solution because it's not giving us the kind of results that we want. So again, in the course of breaking the barriers, we are shifting our service provision to the community, and that is beginning to yield results. So once again, Assumpta and team, thank you so very much. SFH works in solidarity with you as we keep on marching forward.
Highlight of the ceremony was the presentation of awards to deserving candidates for their roles in the elimination of mother-to-child transmission in Nigeria.
For more information on HIV and AIDS and related diseases, or to report suspected cases of stigma and discrimination, violence and human rights violation, please call the National Call Center toll-free on 6222. Reach us via social media at National Call Center or email callcenter@naca.gov.ng and visit our website on naca.gov.ng. Thanks for watching, and as always, continue to support the HIV response. Do not stigmatize or discriminate people living with HIV. Avoid indiscriminate sex. And lastly, know your status and take action. Till next week, on The Last Mile with NACA, I am Ade Suwalsini. Goodbye.